Hello, my name is Jocelyn McGuire. I am a nurse practitioner at Norton Neuroscience Institute's Hussing Family Multiple Sclerosis Center. Thank you for watching MS 101. Whether you are newly diagnosed or have been living with MS, this presentation will help you understand multiple sclerosis relapses and symptom management. Multiple sclerosis is an autoimmune disorder, meaning the T and B cells of the immune system attack the immune system rather than doing what it should, which is fighting off foreign bodies, like bacteria and viruses. Multiple sclerosis' abnormal response of the body's immune system is directed against the central nervous system, which includes the brain, spinal cord, and optic nerves. As MS attacks the central nervous system, it damages myelin, the protective coating around nerve fibers. Myelin covering or sheath is responsible for electrical impulses in the brain, so damaged myelin cannot effectively transmit nerve signals. As part of your diagnosis, you may hear the words relapse, exacerbation, or flare. What do these words mean? The terms are used interchangeably, but all refer to a new symptom or worsening of an old symptom that lasts at least 24 hours and must be separated from the last relapse by at least 30 days. Relapses can be mild to severe and can last days to weeks or months, and can look different for each individual. This is why it is important to pay attention to your symptoms and talk to your specialist if you notice changes. Your provider will assess a relapse by asking about the onset and duration of symptoms. We'll also ask questions to determine if this is a true relapse or a pseudo-relapse, which are symptoms that can feel like a relapse but does not correlate with the new lesion on MRI. We rule out a pseudo-relapse by asking about signs and symptoms of infection, recent heat exposure, recent change in activity, adherence to therapy, or recent changes in medication. Relapses are generally treated with high-dose IV or oral steroids for 3 to 5 days. Acthar gel is an alternative to steroids. It stimulates the adrenal cortex to secrete naturally occurring glucocorticoid hormone, similar to steroids, which can help with inflammation. It is important to treat relapses because treatment of relapses cuts down on inflammation and helps the individual return to their baseline, minimizing your symptoms. It is important to know that the improvement and return to baseline is not necessarily immediate and may take months. With treatment, the relapse symptoms may improve completely, partially, or not at all. After treatment of a relapse, if a symptom does not resolve completely or just partially, we manage the symptom using medication, therapies, or with the expertise of other providers. What causes my symptoms and why are they different than others? Symptoms are dependent on where in the central nervous system the lesion occurs. For example, lesions in some parts of the brain may affect one patient's balance or cognition, but lesions around the eye or optic nerve may contribute to visual disturbances in another patient, and lesions on the spinal cord may cause weakness or walking difficulties in another. Some MS symptoms include numbness and tingling, fatigue, weakness, muscle spasticity, bladder and bowel problems, vision problems, cognitive impairment, sexual issues, pain, and depression. However, symptoms vary greatly from person to person, and the management of different symptoms are unique to each person. Your provider can help you understand your symptoms and how to best manage them. Fatigue is one of the most common MS symptoms experienced by approximately 80% of MS patients. MS fatigue can feel like sleepiness or a lack of physical or mental energy. This can greatly impact your ability to live your daily life. Management strategies include energy conservation, occupational therapy to help organize and prioritize activities, physical therapy, sleep regulation, and medications. Factors that may contribute to fatigue include medications, depression, lack of sleep, hot weather, or stress. Pay attention to your environment and make note of your symptoms so you can work with a specialist to treat the causes. Weakness is another common symptom and can occur in any part of the body as a result of deconditioning or damage to the nerve fibers in the brain and spinal cord that stimulate muscles. Similar to fatigue, managing weakness may include physical therapy, energy conservation, using assistive devices as needed, such as canes, walkers, and wheelchairs, and staying active by utilizing the right exercises. Spasticity, or muscle stiffness, can range from minor muscle tightness to painful, uncontrollable spasms or contractures. This can be frustrating and interfere with your mobility. Management strategies include exercise, daily stretching, physical therapy, and in some cases, medication. Contributing factors to worsening spasticity include heat, infection, improper positioning, ill-fitting clothing, and poor body alignment. Bladder problems are a common symptom of MS. This is a result of nerve signals that control the bladder being blocked or delayed. While it can be uncomfortable to talk about bladder or bowel issues, know that it is normal and it is important to be honest with your provider about your symptoms. Bladder problems can include urinary hesitancy, frequency, increased urination at night, incontinence, or an inability to fully empty the bladder. Management strategies include diet modifications, ensuring adequate fluid intake during the day, and avoiding fluids for a few hours before bedtime, bladder training or planned voiding, medications, or a referral to a urologist. Vision problems are common in people with MS, but the good news is these are usually temporary. In fact, vision problems often can be the first sign of MS. Vision problems can include optic neuritis, which is inflammation of the optic nerve, nystagmus, which are uncontrolled eye movements, and double vision. We know this can be extremely inconvenient and at times painful. Management strategies include steroids for optic neuritis and nystagmus, resting the eyes throughout the day, wearing an eye patch for double vision, and referral to a neuro-ophthalmologist or ophthalmologist. Additionally, memory loss or cognitive impairment is a common mental change in MS. Individuals experiencing cognitive impairment in MS may experience short-term memory loss, trouble with word finding, or difficulty concentrating and multitasking. Management strategies include mindfulness practices, memory exercises, doing things when you think of them, staying organized, using checklists, using an organizer or calendar. Lastly, pain is a common symptom in MS, with more than half of people with MS experiencing it at some point in their disease course. Pain can be effectively managed with medications, exercise, heat, massage, physical therapy, biofeedback, or meditation. An MS diagnosis can sometimes mean uncomfortable and sometimes painful symptoms, but you should not feel helpless. It is important to pay attention to your body and track your symptoms so a specialist can help diagnose and treat symptoms quickly. Ultimately, the goal is to manage your symptoms so you can live your best life. Thank you for joining us. If you have questions or would like to learn more, please contact the Norton Neuroscience Institute Resource Center.